Hello everybody, it's me Feng Ling here, and today I'm going to talk about how a broken heart could actually affect your body. What happens to your body when you experience intense grief or heartbreak? Well, when people experience intense grief, then their bodies would release a large amount of hormones, and these hormones would affect our bodies by um, these hormones would affect our body both physically and mentally, and this could increase heart rate, blood pressure, and then cause problem to our heart and our lungs and our heart flow and our blood flow. So this is why a heartbreak doesn't seem to have physical effect, but actually it does. What is the widowhood effect, and why does it tell us, and what does it tell us about grief? The widowhood effect is an increased risk of death after experiencing losing a spouse or a companion, or after experiencing some grief. Then there would be this effect called this widowhood effect, and studies shown that this could significantly increase the likelihood to die of one person, and it demonstrates how closely emotion and physical health are connected. What is Takotsubo cardiomyopathy, and also known as the broken heart syndrome? Well, Takotsubo cardiomyopathy is a temporary heart condition that would that is triggered by intense emotion or stress after experiencing grief of somebody, and it would cause the heart's left ventricle to weaken and then change its shape into a Takotsubo, and then it would make it difficult for blood to be be pushed all over, to be pumped all over our body, and then it would affect our blood flow. So most patients would recover from this syndrome, but 5% of the people who has this syndrome might be led to death. Why can a broken heart syndrome be mistaken for a heart attack? Well, both syndromes would cause chest pain and shortness of breath, and luckily both of these conditions would use the same treatment, so it would not be that serious if we just get the symptom wrong for a short amount of time. And early diagnosis are really important when a person feels not well, because they need proper treatment for to be able to actually recover. How do stress hormones affect the heart during extreme emotional events? Well, strong emotions could lead to stress hormones actually appearing much more in our body. They would reduce our blood flow, they would weaken our heart muscle, and it will affect the ability to pump blood all over our body. So sometimes when too much stress hormones have appeared, it could actually lead to heart conditions like heart attacks, and also the what is it called? The Takotsubo cardiomyopathy. Who is most at risk of developing broken heart syndrome? Well, I think that anybody could actually develop a broken heart syndrome, but postmenopausal women appear to be at the highest risk, because they believe that there are some kind of hormones and cells that would be that would not appear in these people's bodies, so that they would be at a higher risk to actually get this syndrome. Why is it important to take emotional health as serious as physical health? Well, because emotional health could eventually affect our real physical mental health. because our real physical health. Because, like as I just said, even just by experiencing grief in our emotions, in our brain, could actually lead to real physical problems to our heart, our blood flow, and our like whole body. So like seeking support during like both emotional and physical health could like help recover much better. And good health also depends on like caring for both your mind and for your body. What are some healthy ways people can cope with grief or emotional stress? Well, I think that maybe people could actually talk with the people that they trust, like families, friends, maybe um, like I forgot. Okay, let's move on. So also they could also ask for help from like medical people and like professional counseling. So I think that this could help um, that person reduce the amount of stress. And also they should keep like they should maintain a daily healthy routine, because like when they live in a healthy daily routine, then like regular exercise, enough sleep, and relaxation techniques, then these would eventually reduce their stress. After watching this talk, what is the most important lesson that you have learned? Well, I think that the most important lesson that I have learned is that a heartbreak won't only affect my mind and my emotions, but also my physical health. So I would be sure to like go find like professional help, or like help from professional people, so that I could recover better in both my mind and my body if I ever have to experience grief, because right now I have not experienced that. Well, thanks for listening, and I'll see you in the next video. Bye!